So this is me, Dr. Fanucci. We're going to do another video today on how to do fear-free, low-stress handling physical exam in a dog. So we're going to enter the exam room now already fear-free mode. So we're not going to knock on the door. The owner already knows that we are coming in. So they are instructed to keep the dog on a leash or keep the dog in the room. And we're going to go in very friendly, but without having direct contact with the patient first. So here we go. Follow me. Is she safe?
Yes.
Okay. Hi, Junie. And this is Junie. So what are we seeing Junie for today? How is she doing?
She's doing pretty well.
Doing pretty good? Okay, cool. So no vomiting, diarrhea, no signs of disease, nothing that you are concerned about?
No, not unless she eats something that upsets her stomach, which is fairly rare.
Okay. So what we're doing here for her now, I came in, I talked to the owner, complimented the owner. So sometimes we're not able to do that if they are reactive. They don't allow me to approach their person. But she was pretty friendly, pretty receptive at that. The first thing that I did is kind of ignored her completely. And I just said, hi, Junie, but I didn't try to interact with her or go directly to her face and try to pet her. So we allow them some time to kind of acclimate to the room. And that's what she's doing right now. She is exploring and she's allowing herself to investigate the room because she sees her owner here as a safe attachment for her. So this is a very balanced, well-behaved dog that doesn't show extreme fear or any reactivity. So she's already offered me a sit, as you can see. I didn't ask her to do anything for me. She knows that I have food. She's offering me what she knows now, which is sit, pretty safe behavior. And while we are talking to the client and kind of asking questions on how they're doing, how their overall health status is, I'm going to start clicker training with her. I did inquire before. I know that she does not have any clicker training background. So I'm warming up here by associating that clicker sound with something good, which is food. And then pretty soon here, after 2 or 3 repetitions, I'm going to start working with her. So I'm going to offer food in my hand. She has a chance to sniff it. And then when her head goes away like that, I click and I reward her. So we'll see if she's ready to look at me. We'll see if she can make eye contact, and she can. So she's pretty straight to that. I never told her what to do or never gave her any commands. I really want her to engage in training with me. And this can only be done for like 30, 40 seconds, maybe a minute. So it does not actually take too much time to have a friendly, controlled interaction with the patient before we actually have to examine them, touch them, or start being a little bit more invasive. So what I want her to realize is that, yes, we are here for a physical exam, but I don't want her to know that. So this is going to be like us visiting a friend today. So I'm already petting her. At the same time, I'm paying her for allowing me to touch. So I give her food and then I pet her. So that means that every time I am touching her, there is food involved. So that's kind of how I want her to understand this interaction here. I'm not overfeeding her. I'm giving her tiny bits of something that, dogs normally like here. And she doesn't know that, but I am already looking at her, and I already started my physical exam. So I'm looking at her face, looking at her eyes, and, while I'm petting her like that, I'm already taking a look to see if I see anything abnormal. So I'm looking at her ears, and we try to not be too invasive with them, just give them an opportunity to associate what we are doing with something positive. So as long as she's taking this kind of treat here, I'm going to keep using it. So I'm already looking at her mouth while she's taking the treat. There we go. I looked at her teeth on the side, and I'm going to try to not be too crazy by, forcing her to do things that sometimes makes them uncomfortable. Good job, Junie. Yes, that's good. Normally, dogs don't receive the direct eye contact with them as something positive. It can be very threatening. So that's why I don't like to start by approaching them invasively and grabbing their face and being too excited about it, because it kind of overexcites them. And if they can have a fear response, they will, and then end up growling or biting me. And I have to be really close to their face so I can look at the eyes, the ears, and the mouth. So that's why I approach differently. This is how we do in low stress handling and fear-free. Very good. Are you ready, Junie, for the next step? Yes? I know you are. Yes. So now we're gonna move to the next step where I need to get to the ground with her. And as you can see, I don't have an exam table. I prefer to do my exams on the floor. Out of all the procedures involved in a vet's visit or in a physical exam, the two most stressful components are putting them on a table, or for the dog is being on top of a table, and the second one is temperature taking. So that's why she's not on a table right now. I want her to feel comfortable, and I'm gonna work with her on the floor. So the way I need her to move to get out of this position so I can move as well, and the way I get my patient to move for me is like I know she likes my food, and I'm gonna toss a treat, make her go over there, and while she's getting that food, I'm going down and rewarding her at the same time instead of getting to her face too closely and overexciting her. So this is how we approach dogs, even if they're not fearful. It doesn't matter. The point is, this is not just for dogs that are fearful. This is for any dog, so they don't become fearful of being to the vet. So there's a stethoscope here. Sometimes they already have an association with this. I always like to show them my stethoscope and have them get a food in close contact with it so they don't perceive this as a scary tool. And then what I'm gonna do now, since I want to listen to her heart, and this is kind of vital information, I really need this information first, even if I don't get a whole lot more. I want this piece here. So the way I'm gonna do is I'm gonna kind of position her, and I'm already listening to her lungs right now while she's getting treats from my hands here. So I put her head where I want her head to be without forcing her or without having someone restraining her physically. I want this interaction to be voluntary. That's why I'm doing it this way. So very good. Now I'm gonna position her on this side here a little bit. And if I am touching her, there's food involved. Okay, I got her right side covered already. We're gonna look at the other side. Here, this is your food. And while she's getting her treat, I'm getting a pulse and listening to her heart. By now, she already knows this is nothing scary. This is a friendly interaction, so I don't have to really restrain her heart or hold on to her. I can just stay here with my stethoscope. She's patiently waiting because she knows food is coming. Good job, Junie. Yeah, see? See what you get when we put this on your chest? See? So we were able to auscultate without, sometimes we get a lot of growling and them tossing around and not wanting us to do much. So now I'm going to give her food here on the floor. And I'm trying to fill her lymph nodes. So far, so good. Touching her body, and I always start with the head and kind of walk my way down instead of coming from behind and surprising them with a palpation. So what I'm gonna do now is I'm gonna have her owner here hold some treats for me and slowly give her tiny pieces, but only when I'm touching her. So I sometimes use the owner's help, because when I see the dog is very friendly and responds well to the client, then they keep the dog involved in something fun while I do the rest of my exam here. So you can go ahead and offer her some food. There we go. Can you stand up, Jimmy? Up. Come on up. There we go. Okay, keep giving her food, tiny bits at a time. And now I'm doing my palpation while she's getting a little bit of food. And with this kind of interaction here, she's more focused on the food than on what I am doing. And I get a very relaxed belly here instead of that tense belly from when we are trying to restrain them and force them into a behavior. So I have a pretty relaxed belly, which makes my palpation a lot easier. I don't have a dog that is fighting me, so I can actually do a much better palpation here and feel her bladder. and the lymph nodes. Very good. Good job, Junie. You're doing great. Yes, you are. And we can check the skin, base of the tail here, the hair. There we go. So as I got close to her tail area here, she sat, and they do that to protect their rear end here. They normally know what's coming, which is temperature taking, right? Which is something that I try not to do in a regular physical exam. And the reason, I'm going to give her a break now because I checked most of everything that I wanted to. Good job, Junie. Yes. So I'm going to give her a break. I got a good amount of information. And instead of now restraining her hard and putting a thermometer in there and getting that piece of information, I can clinically see that this dog is pretty stable. She's not having any symptoms of disease. So the question is, how important is temperature information for me right now at this moment? And how will that affect my decision on giving her a Bordetella vaccine, let's say, if she needs that today, or a dewormer? If I don't really have symptoms of disease and a dog that is not acting sick, like, you know, a dog that acts pretty normal, that is taking treats, that is participating in the training, I don't really have a reason to get that piece of information. There's a lot of discussion on whether to take temperature or not. I'm of the opinion that if I don't have to stress my patient out for that piece of information, then I'm going to probably ignore, even if she has a temperature of 103.2 right now, I probably will not call that a real fever, because I know that she came in a car ride. So, you know, from the moment that she left her house, hopped in a car, it's 97 degrees outside, I know her temperature is going to increase a little bit. And most of the time we check the temperature, it is 103.2, and we ignore that information, give them a vaccine anyway, right? So then why even take that temperature in the first place? So there will be mixed opinions, of course. There's people who disagree on that. But what I prefer to do instead is, if I really need that information now, I will do it, and no matter what, because it's a medical component that will alter my decision. If I don't need it, I'm not going to ignore it. I'm not going to even stress my patient right now, compromise all the progress that we made here just for that piece of information that I don't really care about at the moment. Now, the one technique that I prefer to do is to teach my clients at home to work with the dogs and desensitize them to temperature taking, for example, and then they can take their temperature sometimes at home and tell me when they come over, like, what was the temperature? 102. Well, then that's pretty normal temperature, and we're not going to call that nothing, no fever, no nothing. Rather than it's 102 at home, which is real body temperature, and then they get here is 103.2. And then I'm going to ignore that anyway. So that's the point, and that's what fear-free concept kind of tries to defend and preach for. So if we were going to take her temperature and start teaching her how to accept that, I'm going to just warm up to that point. We're not going to really take her temperature today, but I want to demonstrate how I will teach my clients to do that. And we have also a separate video on specifically on temperature taking desensitization, where we work with the dog from step 1 all the way to the end until we can actually take the temperature with the dog standing there voluntarily without us having to do any physical restraint. So yes, that is possible, and that will be one of our videos that you can find in our website.